I'm Dr. Anna Guanche. I'm a board-certified dermatologist specializing in cosmetic procedures. The difference between Botox and fillers is that Botox is a protein that inactivates muscles and prevents you from overexpressing your face so that you don't get wrinkles. Over time, what happens is you lose elasticity in the skin. So when you're a little kid, you can make any face you want to and your skin bounces back with no lines. But over time, what happens is you start to have a memory in your skin. You make an expression, you frown, and then all of a sudden there's a little line left there after you're done frowning. And people suddenly think that you're angry or frustrated or tired or that kind of thing. So we try to get rid of that with that protein. The fillers, on the other hand, are used more in the lower face. They're actually plumpers, because what happens over time is you lose volume in the lower face. And so a lot of these lines around the nose start to show. They're called the parentheses, and we can plump these and kind of reduce those lines with fillers. We wouldn't want to use any kind of protein in the lower face that would inactivate muscles, because we want to have a nice big smile and be able to express ourselves with our lower face. I think it is possible to have an allergic reaction to the fillers. However, I have done thousands of filler procedures and I've never seen an allergic reaction to Juvederm. Common side effects with injections include a little bit of redness, bruising. There's a little bit of discomfort with the injections. Even though we put a topical anesthetic on, you still feel a little bit of discomfort. And then redness usually goes away within 2 days, but can persist a little bit longer in certain individuals. Bruising is variable. Some don't bruise at all. Some get a little bit of a bruise, and if you do, that lasts about 7 to 10 days and goes away. Actually, there is some evidence that using fillers over time promotes your own collagen, so that you end up with a better result even after that filler has resolved. So it actually makes your skin better, and many people use Botox as a preventative, because if they're not making frowns or squints or that kind of thing over time, their skin is taking a break from those types of expressions and isn't forming that groove in the skin that you continue to make every time you frown. So it is more of a preventative than anything else. So no, it is not true that it causes more lines when you do the treatment. The fillers, it can be anywhere from $450 to $1,600 depending on what type of filler is used and how much filler the person needs. For example, if someone is very young and they don't have a lot of lines or a lot of volume loss, they may get away with 1 syringe of filler. If they have a lot of deep lines and have never had a treatment before, they may require anywhere from 2 to 3 syringes of filler. Botox can cost anywhere from $250 to $800 depending on how many areas are treated. There are 3 main areas that we treat: the glabella, the forehead, and the periorbital lines, we call them. So for the squinting or crow's feet, for the horizontal lines you get across the forehead, and for the frown lines that you get in between the brows. So those 3 areas are the main ones that we treat, and if someone is concerned only with one area, they can get away with $250 to $300 worth of Botox. If they want a perfectly smooth upper face and they have problems in all 3 areas, then they may be spending up to $700 for a treatment. Botox treatments generally last about 4 months. And at 4 months, you're fully back to your muscle function that you had prior to your treatment. So you're completely back to baseline. A lot of people will do their next treatment at 3 to 3.5 months after their initial treatment. As far as fillers vary a little bit. Juvederm is a hyaluronic acid type filler that lasts 9 months to a year. Collagen, for example, only lasts 4 months. Fillers like Radiesse can be longer acting, 1 to 2 years. But each type of filler has its own characteristics, so you don't use this, one filler is not good for everybody. There are certain areas of the face that do better with different fillers, certain types of lines that do better with different fillers. So I kind of evaluate each person's face and expression and what their goals are, and then determine what type of filler to use.